Hey migraine sufferers, we have some amazing news for you. The FDA has approved the first drug to prevent the terrible headaches that affect an estimated 36 million Americans. If you've ever experienced a migraine's debilitating pain, you'll appreciate how big a deal this is. And even if you haven't, we're still going to tell you about it. Here's what you need to know about the new migraine treatment. The new drug is called Erinumab, trade name Aimovig. It works like an insulin pen in that you inject it at home under your skin. The drug works by delivering antibodies that target migraine-causing proteins, and the treatment is meant to be preventative, with patients injecting themselves once a month. These migraine-causing proteins are called calcitonin gene-related peptides, CGRP for short. They relay signals between sensory nerves and dilate blood vessels. CGRP was first discovered to play a role in migraines in the 80s, and since then it's been found that people who get migraines seem to produce too much CGRP. Aimovig blocks CGRP in the brain's lining so the protein never actually enters the brain. The antibodies can remain in the body for a long time and only need to be replenished every so often, which is why only monthly injections are needed. There are a few other very similar drugs being developed that are also in the final stages of approval. In clinical trials, Aimovig and similar drugs seem to have produced immediate results with very few side effects. That said, these drugs aren't expected to bring an end to all migraines. Sorry, folks. Most people who suffer from migraines multiple times a month can expect that number to drop by half, and for the overall pain and suffering to become much less severe. That's still a huge improvement over earlier drugs, which have had mixed levels of success, often proving to do very little at all. So, as you can probably imagine, the emergence of a drug that can effectively relieve the pain is a pretty big deal. These new drugs are particularly meant for the 3.2 million Americans who have chronic migraines, which means they experience them multiple times a month. But on a larger scale, 1 in 7 people globally are thought to get migraines, if only occasionally, which makes it the third most common disease in the world. Okay, now for some potentially harsh news. The Aimovig drug will cost you $6,900 a year. For those who suffer multiple migraines a month, that cost could very well be worth it. For someone who only gets a few a year, maybe not. We'll let you talk to your doctor about that one.